Governor Mike DeWine has called in the National Guard to help the state's hospitals, seeing staffing shortages because of the rise of COVID-19 cases. That shortage can be felt in local areas too. Sartaj Singh talked to a local hospital to see what they're experiencing.
Earlier in the pandemic, our concern in our hospitals was about beds, was about space. Today, it is about personnel.
Starting Monday, there will be a little over 1,000 guardsmen deployed in hospitals, mostly in the northeastern part of the state. 150 of the members have medical training and will be helping on the front lines. The other 900 will be used with other duties like transportation and food service. The Ohio Department of Health is also working with a staffing company to bring in additional medical help from outside the state. As for the Lima hospitals, staffing is an ongoing concern.
So we have all the adequate supplies and resources that we need in that fashion, ventilators, etc. But unfortunately, our staff remains the most challenging and the most challenging area we have.
We continue to have a shortage of staffing that we've endured for the past 22 months, really, as long as this pandemic's been going on. And it's in all areas, both clinical and non-clinical. But certainly we have a significant shortage of nursing folks available, as well as some of our ancillary techs.
There are more than 4,700 patients in the hospital statewide because of COVID, which is close to the spike in cases we saw last December. And the northern part of the state is seeing the most patients.
The last few days we've seen a slight decrease in our admissions, but we are still at or near capacity. 90% of them unvaccinated. Our critical care units are still full. A number of patients on ventilators.
Both hospitals are preparing for another potential spike after Christmas.
We're preparing for whatever the next few days may hold. Next few weeks may hold. We are taking it one day at a time, 1 week at a time.
In Lima, Sartaj Singh, your News Now.
Thank you, Sartaj. And here in